Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend Colin. The world of technology and healthcare, ever changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways, which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. Today, we're going to be doing our 2025 healthcare IT predictions. And today's episode is sponsored by Pure Storage, the data storage platform that grows with you forever. Learn more about how Pure Storage supports healthcare at purestorage.com/healthcare. And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 19 years of health IT content at healthcareittoday.com. Whew, 2025.
It seems so far away, and yet here we are.
Yeah, I mean, this year has flown by, I think probably because we've been everywhere. That's what everyone tells us anyways. I'm like, I haven't been some places. Colin went instead of me in some.
I think that's it'll be interesting to kind of to do the poll and see if people actually thought I was at the conference that you were at and vice versa, right?
Oh, that's
are we that
interesting.
interchangeable? So therefore, it looks like we went to over 100 conferences together.
Well, it does make us appear like we're everywhere when Healthcare IT Today is sharing about stuff from all the different conferences we went to.
That is. But yeah, I know, you recently wrapped up your conference season. I know a lot of the talk is, and I certainly get asked a lot of this, like, what are we looking forward to in 2025? And specifically, John, what is your prediction for healthcare IT in 2025?
So I got a few that are a little out there, all right? The first one probably isn't too much out there, but I think 2025 is going to be about autonomous AI. So not just using AI, but AI working on its own. And I predict that in 2025, there's going to be 2 to 3 like scandals and like mini scandals, if you will, where they're like, oh my goodness, how come AI did that? Right? Like some bad patient outcome or some ridiculous thing that a doctor got or messages to 5,000 patients that shouldn't have been sent. It should have only been sent to 5 or, some, like I said, it's not really a scandal, but definitely is going to, leave a mark on the industry. The people are going to report on it and say, and there's going to be this like faux outrage, really. I say faux because people are going to be really outraged, but it's like, it's going to be a little over the top compared to what actually really happened, and that's going to hit the press and it's going to blow up. So that's my first one. My second one is I predict that the new administration, the Trump presidency, won't change much in healthcare. In 2025, we're not going to see many changes. It's going to be mostly business as usual. Sure, they do a few things here or there. There's a few budgets they have to approve for Medicare or Medicaid or a few things like that that may happen. But I actually don't think we're going to see anything massive, especially on the health IT side. Medicaid cuts may happen, right? And that that would be the closest thing to like a major thing that I think is going to happen in 2025. But I actually think that we won't see much impact on healthcare IT.
Interesting. I have an opposite view and a similar view. So, um, when people have asked me recently about what I think about 2025 in terms of health IT, I think next year, like you, there's going to be some AI fallout. And what I mean by that is, I think there's some areas where AI was overhyped, and I think in 2025 we're going to get the reset. And it's not going to be like, yeah, I think it's really more like, hey, like we thought it could do this, but we finding out there's actually some unintended consequences of that, and so maybe we want to back off of that, right?
Okay.
Um, but I also think that there's going to be some fallout in terms of people are waking up to looking at what these things were trained on. And I think it's very different when you're talking about, well, it was trained on millions and millions of claims transactions. I think that's fine. But when you get into clinical applications, I think people are going to start to realize, hey, this was trained on like 50 to 60-year-old white males. And we tried to apply this to this other community, and it's not quite working as well as we think it is. And I think people are going to get the fallout of, well, wait a minute, like that wasn't right. Like we should never have applied this algorithm to that
Mm,
community because it was never built for that community. And I think we're going to start to get some of those kinds of stories finally bubbling to the surface. Now, I
interesting.
also think there's going to be a couple of cases where maybe the AI will actually surpass expectations, but not
Mm,
very many. For me, the other thing I think we're going to be talking about in 2025, I think we actually are going to get some regulatory changes. I
mm,
don't know how that's going to impact health IT, and I don't think, to your point, I don't think it's going to be specific to health IT.
mhm,
But I think some of the things around medical devices, I think some
mm,
of the things around cybersecurity, I think those were already in the works. I don't think this is something that the administration is suddenly going to bring up, but I think these are already had been making their way through the state level and some of the federal level institutions. So I think we're going to start to see some of these requirements come through. So I
mm.
do think actually we're going to be talking a bit more about regulations in 2025.
Interesting. Yeah, I mean, I've heard people say NIH is in trouble, FDA is in trouble, CDC is in trouble. I think it'll be interesting to see how that plays out. Medicare's in trouble. Some people are saying, I mean, yeah, there's definitely predictions along those lines. So it'll be interesting to see how that plays out. You know, the other one that I would make for 2025, I actually predict we're going to see the like first hint of a competitor to Epic. I think there's actually is like possibly a space where people would replace Epic. And I think in 2025, we're going to see the hints of someone who could. We're not going to see any replacement of Epic yet, but we're going to see them replace some pieces of it or something like that, where you're like, oh, interesting. And you could see how that maybe could go after some of what Epic's doing. I think there are some people that are not happy with Epic, right? Epic probably knows as much as anyone else, right? And so, and there's some people who just like change for change, right? There's some CIOs that just like to be to do something counter trend, right? And so some of them are going to be looking for something to do that, to not be on that bandwagon. So, it won't definitely won't disrupt it, next year. But I think we could see the hint of someone you're like, oh, interesting. Where will they go? And now will they get chomped up before they can and all sorts of things? But it'll be interesting to see, someone that could potentially compete with Epic.
Yeah, it's funny. You're hinting on something that we had a pretty interesting discussion on at HCIC back a few months ago, and that is 2024, the latter half really proved that being an incumbent actually was in disadvantage, right? And
Mm,
this is sort of larger tech, right? Like people want to find a reason not to be on Facebook. People want to find a reason not to be on X, although there wasn't a lot of reason not to be on to be on there in the first place. But being a technology incumbent was actually now viewed as a bad thing, right?
mm,
And to your point, I think people are hungry for give me an alternative and I'll take a serious look at it because I just want to change. I want to see something different. And maybe the incumbent organization isn't providing enough of that for me. So, I mean, we see that with governments, right? No incumbent government has made it in the Western world, except for one. We're in that mode of we want some change. So, pretty interesting you say that. I'll just mention one more, and then we need to move to the next question. I think next year we're going to, in the US, talk about a topic that we've talked about forever in the UK and Canada, and that is access to care. Because I
mm,
think the shortage is finally hitting, and we're hearing this on the marketing side now, where we have to match capacity to how they're being marketed. And I
mm.
think now we're starting to see the term wait times, and I can't get an appointment for 6 months, right? Like that was unheard of in U.S. healthcare for a long time, but now I think that we're going to see more and more of that as the access and as the need for care just increases over the next year.
Yeah, I just had heard a patient that they were supposed to get into their doctor, but they couldn't see him till February. So they went to one of the other, colleagues in the office, and they went to that colleague who was a new doctor and had an awful experience. And so, I think it does become a bit of the, haves and have nots as far as how their skills. And sure, you'll be able to go into an ED or urgent care to get, the emergency stuff. But for anything that's longer term, the people that are able to evaluate your true wellness, I think you're right. That's going to be hard to get into, let alone specialists for certain procedures and things like that.
So, John, let's talk about a specific area of healthcare, cost of healthcare. What do you think is going to happen in terms of cost of healthcare in 2025? Is it going to improve? Is it going to decline? What do you think?
Is the cost of healthcare going to improve in 2025? No. But here's the thing. I will say this caveat. It may not get worse though. Like, because there are some things happening to kind of bend the cost curve a little. You see, obviously my favorite AI medical scribes and stuff that are changing some of the equation. There's interesting, stuff around prior authorizations and automating those. That's pretty interesting. That, when you look at the move to value-based care is pretty interesting. The ACOs are grabbing a hold, so I think it's going to get less. I don't know anyone that's ready to take a pay cut. I haven't heard any volunteers who wants to get paid less, but we may be able to stem the tide, at least, flatten the curve a little, when it comes to the cost.
Interesting you say that. So yeah, I think overall, I think it's ridiculous to say that, healthcare costs are finally going to come down. I think that's almost impossible. But you're right. Maybe we may be able to hold a line or make it flat in certain instances. I certainly think that the costs related to the business of healthcare, processing
Mhm.
claims, doing HR, managing things in the cloud, those kinds of things, I think actually will at least flatten, if not decline in some cases. Because I think those have been so commoditized now where I can get very competitive quotes and very competitive vendors to do things for me in that sense. So I think from an operations standpoint, I think costs actually will come down a little bit. Um, but in terms of actual provision of care, I don't think the costs are going to come down at all. I think we're still going to be struggling with the cost of procedures and clinicians and the workforce and so forth.
Yeah, I mean, I think there are a couple other things that are interesting to watch. Mark Cuban's cost plus drugs and what that impact on drug pricing. And he's going full guns blazing after pharma and the pricing and how screwed up that is. So I'm interested to see how that plays out. Will he be successful? He's obviously, David versus Goliath in a lot of ways, which is amazing to say for a multi-billionaire. He's David in this case, but he's definitely raising the specter for companies to say we shouldn't be doing it the way we have done in the past. The other one that's fascinating for me is Dave Chase and his Health Rosetta. And really it goes along the same lines, which is helping employers better understand PBMs and the costs for their healthcare and how they could reframe it to be in a better structure. And so I think some of those things, I don't think they'll quite overwhelm the system in 2025, but they do seem to be gaining traction. And so could that show a promise for a better day, and reduce the costs for a lot of employers, which I think that's where the key is going to be is, do the employers want to lower the costs? Does Medicare want to lower the costs, or are we going to, bow to, the different people lobbying in DC? Yeah, I think that will be interesting to see.
Yeah, I mean, if you believe some of the political pundits, right? Like the one area where I think there's sort of universal agreement is the cost of drugs are way too high, right? And you could argue which drugs are too high and which aren't, but in general, I think most on both sides are just going that it's not right. The US makes most of the drugs and yet pays the highest cost for those same drugs versus countries like Canada, the UK, and so forth. So I think there's going to be some alignment there. Now, whether those savings are going to be passed on to you and I as individuals still remains to be seen. But I think that's something that the administration seems to be willing to tackle, or at least, and to your point, people like Cuban and others are starting to raise the banner, right, and bring this to a head. So that'll be interesting to see whether or not drug prices actually start to come down a little bit in 2025.
Well, and it's fascinating too, because you're right. The cost of IT, the cost of infrastructure, the cost of devices, all of those things have been coming down, in a big way. But the problem is we're going to have the cost of AI, and that will probably shoot things up for an IT expense and for your IT budget, for at least in the short term. So, I think that one will be a little bit of a balance, I think, of the two.
You're just tuning in. You're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we're making our healthcare IT predictions for 2025. But before we get to the next set of predictions, I want to take a moment to thank today's sponsor, Pure Storage. We all need a data platform that is reliable, efficient, and manageable. Data is growing and requirements are changing. What feels sufficient and efficient today may not be tomorrow. Just like our own personal health, it's important to routinely monitor your IT infrastructure. That's why Pure Storage has created a quick quiz to help you start a conversation about whether your data platform is future ready, or maybe it's time for a checkup. Go to healthcareittoday.com/pure storage, all one word, to take a quick self-guided quiz and start on your path to more reliable and flexible data services. So, John, I'm interested in your answer to this one. Which companies are you going to be watching in 2025?
Yeah, well, I mean, it's interesting. Pure Storage is the sponsor. Like it was amazing that they're rolling out some of their stuff to the cloud. So I'm definitely going to watch that. I thought that was a fascinating. We know how good Pure Storage is, and your own infrastructure, in-house infrastructure. But I love that they're offering some of the same resiliency tools in the cloud. So anyway, that's an interesting one to watch. But one that cropped up for me that I don't know why I haven't been talking about it more is Solventum, which was a rebrand of multiple
3M.
companies that kind of merged together. But they have quite the suite of services, and I think that a lot of healthcare organizations love that they have the full suite of services, from RCM to clinical documentation improvement. They have an AI medical scribe, which obviously correlates with that. All the scribes are going towards that as well. So I think they're an interesting company to watch because they have that full spectrum of, and it's right in the target people want: efficiency, revenue efficiency, driving the right outcomes for the organization. So I think maybe they're one that I haven't talked about enough that I probably should talk about more. Another area is identity management. Clear seems to be dominating this conversation for a lot of them, and it kind of makes sense. They already have millions of people in their database that they have identified, positively identified in a number of different ways. So could that become the identity management platform for healthcare? There's a lot of companies that are offering that at least as an option. And then, of course, within the identity management, you have the Verado, Rhapsody, Formedica that have the enterprise master patient index. I think identity really is going to be a big topic, especially now that we're exchanging so much data and we're doing AI based on the unique identity of an individual. And as AI gets more personalized, we better make sure we have the right identity. Otherwise you're going to screw up the AI. So I think those are a couple areas that were interesting for me.
Those are good companies. For me, it's funny because when I was thinking about it, a lot of the companies that are on my mind and I'm going to be watching in 2025 are fairly large players.
Mm.
I'm going to be keeping my eye on a lot of the EHR companies. So one in particular, Oracle.
Mm.
I just
Yeah,
think,
everyone's going to be watching
yeah,
that.
I think everyone's gonna be watching that for a number of reasons, good and bad, right? Like on the positive side, I was very impressed with their revamped EHR. With that Oracle bar at the top. I think I did a preview, and you can go see it on Healthcare IT today. I was impressed. Now, whether or not it's going to be a hit with users, the implementation remains to be seen. But I think there's some positive signs, and they did rewrite it to leverage Oracle Cloud, which is very powerful, very solid technology. So
Very
very
secure.
interesting to see how that is going to pan out in 2025. And then the others like Meditech, Greenway, eClinicalWorks, NextGen, all of them have some very, and Dr. Chrono, lots of very interesting technologies and approaches to AI. Some have leaned heavily in, some are sort of taking it only as the proven ones and implementing that. So I'm keeping my eye on all of them to see how they're going to roll that out in the next year. And all of them have very unique things that they're doing to try and make their systems and solutions much easier to use for their community and their users. So I'm definitely going to be watching those guys.
Yeah, I mean, I think we underestimate how good those companies are doing. We think you need to have 7,000 hospitals, but it turns out you don't, right? Like they have very good business models with devoted users that don't want to change. And so, yeah, someone was saying, "Oh, are we going to see all this consolidation, or are those EHRs almost dead?" I'm like, "No, not close, right?" Like they're still doing quite well. So that's an interesting one. I would also look at companies like Artisite They're in the like
Mm.
smart hospital automation space. So it's overlapping of devices, monitoring, efficiency, and AI, right? So I love companies like that. You also have interesting companies like Doctor First and SureScripts, on the prescribing side of things. I'm interested to see what SureScripts does as a QHIN and where that all goes. Dr. First obviously is doing a lot with e-prescribing and the solutions there, but they also even have Backline to be able to do telehealth, to do advanced directives, or other types of things like that. So I think that's interesting. And then one other that I love this area, which is like the data area, and we could probably list off a ton of companies, but Komodo Health's doing incredible stuff. I think they have a challenge, like how do they serve life sciences and provider organizations? It will be interesting to see how that plays out for them. But they have the data that a lot of us want to be able to do stuff. And even like Altera Health with their DB Motion product, if you will, that they have, I think them and how they use that data, how they use the viewer of that data, because it's one thing to share all this data. I heard this coming out of Sequoia Project and eHealth Exchange Care Quality, that their national events, their annual meetings, and it's like, okay, great, you shared millions of records, but then what, right? So you do need a viewer on top of it to actually turn that data into information, which becomes wisdom and has value for the organization.
Yeah, I'll just throw a couple more names out there of companies I'm definitely going to watch. I'm keeping my eye on the RCM space because I think there's going to be some interesting consequences from what happened this year with the system, with one system going down and taking down everyone with it. So I'm keeping my eye on Novolon, AGS Health, companies like that. I'm also keeping my eye on some of the really large companies like Microsoft, Amazon, right, to see what they're going to be doing and continue to do in this space. GE Healthcare and Philips, especially as they move more and more to consolidate their imaging platforms onto a single platform and offering more in that space. And then the sort of out of left field one that was Kroger.
Mm,
So, they're one of the few retailers that are actually successful at what they're doing in terms of retail health, not trying to do too much. And so I'm going to keep my eye on them to see if they can really be the banner holder for retail health in the future. Whereas everyone else is closed, they're continuing to open new
yeah.
places. So I'll keep my eye on that.
Interesting. In the big category, I would throw in like ServiceNow and Workday. It's like the
Mhm.
two sleeping giants within healthcare. Workday has such a presence in the ERP side, ServiceNow on your service desk, and other, offering a bunch of solutions. Like from the enterprise perspective, those two, they don't get talked about a lot, but they're used by so many, almost as much as Epic, which is fascinating to think about. Just maybe not as big an implementation.
Well, we can't talk about predictions, John, without talking about your prediction for conferences next year. Are there any conferences that are going to be trending up or trending down in your mind in 2025?
So my prediction is we're going to go to fewer conferences in 2025 than 2024. That I don't know. I don't know if it's possible to go to more, but I think it's interesting. I would say I'm predicting that user conferences are going to continue their pathway up. So the user conferences, those are trending up and have been trending up, and they're going to keep trending up. So I think those conferences are going to continue to do really well. How about yourself?
Yeah, hard to argue there. And I think it's partly because I think they're valuable, but I think also they're easy to justify, right? It's easy to go, why do I need to go to X or Y? It's because I use it. And when I'm there, I'm going to learn more. It's easy to justify and get the budget for that. It's a
Yep.
little bit harder to get justification to go to Miami for like some, a generic overall conference in health IT, right? So
Yeah.
I think as a consequence of budget. So I agree with you there. I think actually we're going to see a decline for that reason, a decline in some of the larger conferences that are on the circuit. So I think some may hold the line, but I think some may be smaller than in years past. Not by a lot. I'm not saying a huge drop off, but I think just the hit of budgets for both the provider side as well as the vendor side, and just looking at the ROI, going, I don't get a lot out of those big shows, so maybe I'll go once every 2 years now. So I think that's going to enter into the thinking. So I think, for the large ones like the HIMSS and the Vives and the Healths, we're probably going to be at the same size, if not a little bit smaller than we were this year.
See, I see the opposite. I actually see the momentum of, oh, I can meet so many people all at once. This is pretty awesome. So I do want to go to the large shows and I can just hit them all at once. I don't have to go to a bunch of small ones to meet with who I want. So I actually see the large ones continuing to grow. What I actually see is almost a saturation of these mini ones. The
Mm.
mini dinners, the mini events. I feel like, I heard a CIO tell me this. He's like, John, I just can't go to that many, right? Like, and he kind of wanted to, you can hear it in his voice, but he's also like, I got to do my work. I can't go to all these things, and how, so I think there's a bit of a saturation in these kind of small ones with just specific vendors that are kind of in some ways veiled lead generation for these vendors and things like that. So, it'll be interesting to see how that plays out, because, we will have to do an episode next year to see who is right and who is wrong.
That's right. And I think you're correct in the sense that I don't think it's possible to go to more conferences than we did in this year. So I think if anything, the smart prediction would be we're going to feel like we've gone to less.
So here's the question for you, Colin. Is there a conference you didn't go to this year that you really want to go to next year? I really wanted to go to Arab Health, but like the dates, I looked at them and they're bad for me. So I was like pretty disappointed. The other one I didn't go to this year that I'm like, maybe we make it happen is South by Southwest. I haven't been for 4 or 5 years, probably pre-COVID. And so I'm like, is it worth inspecting again to see, has it grown as far as the digital health footprint or not? Anyway, do you have any on your list that you're like, or maybe
There are
you
a
were
few.
jealous that I went.
Yeah, there were a few. There were a few. I mean, I would love to go to HIMSS Europe or Health Europe. I
Mm,
haven't been, so those were two on my list to say, I wish I could go to those. CES, possibly. It's been almost a
mm,
decade since I've been to that one, so that's one on my list as well. Yeah, and then, I think the only other one that it's more of the marketing side is Content World.
mm.
I've always had that on my list to kind of check it out. There's a lot of healthcare people that go to that one. It's very marketing specific, but that one was on my list as well. So yeah, I mean, hopefully that can happen in 25, but if it doesn't, then I'll just, that's okay.
Yeah, there's so many. Although I still go back to my favorite are the user conferences. That's where I think you find most of the users, and they still are my favorite. So there's a few user conferences I haven't been to, that I think would be interesting. Like, Workday is an example. I haven't ever been to that, and it's in Vegas. I think every year, at least it has been for a while. So I'm like, why haven't I gone there? I probably should have.
No, you're right. And definitely it was a lot of fun this year to go to the Greenways, the Next Gens, and those kinds of user ECW's conferences. And it is very different to connect with the attendees at those style of conferences versus a HIM. It's just a different kind of conversation, right? Like, and much more concentrated. So definitely had a good time this year.
The one that's not as good for healthcare is actually the cloud ones. AWS, Oracle Cloud World, Google Next, Microsoft Azure. There's some healthcare people, and I always randomly found some people, but because there's every industry, it's hard to find the healthcare in it.
Yeah, the generic ones are hard. Again, just like CES, right? The majority of CES is not focused in healthcare, so you have to work hard to find the healthcare folks there.
Yeah.
But hey, that brings us to the end of this episode. And thanks to all of you who tuned in today to Healthcare IT Today. And I want to take and thank today's sponsor, Pure Storage. Try their self-guided wellness quiz today at healthcareittoday.com/pure storage and take the first step towards a more reliable and future-ready data platform. You can find more details about our show by checking out the programs page on healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on social media using the hashtag HITSM. I'm Colin Hung, along with my friend and health IT collaborator, John Lynn. Thanks for listening and have a great week.